Dr. Gupta, thank you so much for this great opportunity to talk to you. So it's been 6 months since you started the podcast, Coronavirus Fact versus Fiction. Would you summarize what are the most important facts that you've learned so far, and what are the fictions everybody must be aware about?
Well, I think that the most important fact is that this, we are dealing with a novel virus, and that's truly an important term because I think as physicians, but just as human beings, we immediately want to look at something and think, this is acting like something I already know. I want to put it in a certain box. It's acting like a respiratory virus. So let's treat it just like respiratory viruses. But when we say something is truly novel, that's a pretty unusual thing because there's not a lot of context or previous lessons we can necessarily look to and say, this is exactly how we should be behaving. I think that that's perhaps been one of the most important things that we've learned through this. And we've also learned that when it comes to things like pandemics, something that's affecting the whole world, that we are really all in it together. I mean, how you behave where you are affects me in some way, and how I behave where I am affects you on the other side of the planet. I think that, some of the big myths are that that this was going to be something that would just sort of go away on its own. And that's because other viruses have, like SARS, for example, back 17 years ago, very deadly virus. I mean, people may not remember, but it had a infection fatality ratio of 10%. So 10% of the people who were becoming infected were dying. But as it turns out, it wasn't very contagious. There was about 8,000 people around the world who became infected and around 800 people who died. So this became pretty clear that it was very contagious, and it wasn't just simply going to go away. While it might have seasonal up and downs a bit, as viruses often do, that it wasn't going to go away, that we needed to be proactive in a situation like this. So, we are learning all the time about what this virus does to the body. Despite the fact that it's a respiratory virus, it does seem to create a significant viral/inflammatory load in the body. And that affects, as you well know, doctor, that affects many different organ systems because the inflammation may affect perfusion to certain organs. It may affect how the blood actually creates these inflammatory proteins called cytokines. And sometimes, as we know, the body's response to this virus can be as devastating as the virus itself. So we have to both treat the virus, and we have to modulate the body's response to this virus as well. So there's a long list of things, doctor, but one thing that I think is worth pointing out, just from a more human standpoint, again, is that some of the lessons that are being applied right now to try and address the spread of this virus are basic public health tools that we've known about for hundreds of years. And the amazing thing to me, being here in the United States, is that when you live in an environment where you have lots of resources, you have to remind yourself not to forget the basics. You can say, oh, I can just take a medication for that, or I can get an operation for that, or I can just go to the hospital and get treated for that. Well, the basics apply. And if we had applied the basics, I think with greater rigor here in the United States and some other places around the world, we'd be in a much better place overall with regard to this pandemic. So some of the lessons from hundreds of years ago, still apply today.
Yeah, we absolutely interdependent, and this virus is amazing. I've been trained as immunologist, and never seen anything like this one. It's just unbelievable.
Yeah.
Pandemic. So, Dr. Gupta, you interviewed dozens of distinguished individuals, scientists, public health officials, politicians, businessmen. Who of them had the most impact on your better understanding of the current pandemic? So what is the most surprising thing you've learned from them about coronavirus?
It's interesting, Doctor. Because it is so novel, typically when I'm doing interviews with scientists, I am talking about their own research, and talking about the data that they've been collecting typically over years on a particular topic: cancer, heart disease, neurodegenerative disease, whatever it may be. With this coronavirus, a lot of times the conversations were based on days worth of data or weeks worth of data. So what was fascinating to me was, even for world renowned infectious disease doctors such as Dr. Anthony Fauci, Michael Osterholm, people who really have been at the forefront, Larry Brilliant, they've been at the forefront of this for a long time. Even they were learning in real time. I mean, it was humbling, I think, for everybody. And nobody had all the answers. And anybody who said they had all the answers was probably making it up. But I think some of the most fascinating interviews for me have really had to do with I think human nature a bit. Because I'll give you an example. If I tell you something is 2%, has a 2% lethality rate, 2%. If you're a public health person, that is very worrisome. A flag start to go off, antenna raise. 2%. That's a huge number if you start to apply that to populations. But for the average person who doesn't think about it from a public health perspective, they think 2%, 98% chance I'll be fine. Why would I worry so much about this? So how do humans perceive risk? I think some of the conversations I've had with people about that, I think are really interesting. And here's another one I'll just tell you quickly is, when we're in the middle of a situation like this, a pandemic, there is a conversation that happens sometimes publicly, but sometimes privately, about um, who are the people who are most likely to suffer in this sort of situation. So we know, for example, people who are elderly are more likely to become sick from this disease. Would our perspective be different if it was primarily young people, children, who are more likely to become infected by this disease? It states things about our values, I think, as a society, and it differs from culture to culture. In the United States and North America may be different than in Asia, and different than in South America. Like, I'm Indian. Huge premium on intergenerational families, and great, tremendous respect for our elders. And I think that's true in a lot of countries around the world. But in the United States, the question is, if this had been something that was primarily affecting young people, would we have responded differently? Those conversations fascinate me, Doctor, just because I think they strike at the core of who are we as human beings. Where is our humanity in all this?
Yeah, it's a just fascinating perspective. I never thought about that. Like, if it's more affecting children, how would we react to that?
Yeah.
And yeah, your interviews with Dr. Fauci and Dr. Hasselholm is fascinating. I saw in your fact versus fiction and CNN town hall meetings and everything. It's really interesting discussions. So somehow related to that, so the pandemic has changed everything, particularly the ways we think about healthcare and how we practice medicine. So how does it affect global healthcare? Do you believe we need to train more public health doctors rather than clinicians?
Yeah, I really do think so. I mean, we, even before this pandemic, I think we could have made a strong case that we need to be really investing in public health, both in terms of training physicians and medical professionals in public health, but also building up our public health infrastructure overall. I mean, truth is, if you go back and look at 2009, the last pandemic, H1N1, versus 2019, 2020, this pandemic, global travel has more than doubled, and we are far more interconnected than we ever were before. So I think not only do we have to invest in public health in our own countries, but we do have to invest in global public health as well, because we said back in 2014, which is obviously a very different disease, but we still made this comment, which is that in an infection anywhere is an infection everywhere now. So when it comes to disease surveillance, to really understand surveillance, really understand how this process of zoonosis, jumping from animals to humans, is happening, being able to surveil that early, and then being able to really have public health systems that communicate with each other quickly, so that we can quickly flag something that is starting to become a localized outbreak before it becomes something that's more widespread. So I've always believed in this. I mean, it's part of the reason I got into this business. Was in some ways I felt like doing reporting on this was providing a public health service. But I've always believed that public health, it's the cornerstone of keeping large societies safe and healthy. And we haven't been investing in that. In fact, if anything, in the United States, we have been pulling back funding on this over the last, really 10, 20 years. We need to invest in that. We need to have plenty of surge capacity in order to take care of future events like this, which are likely to happen.
Yeah, and clinicians probably have to have much broader perspective for what they're doing in the clinical work. So that needs to be somehow differently approached. I think that during the medical school curriculum, I guess. So yeah. That's important.
I'll say one thing about that. It's interesting. I don't know if you've been dealing with even with this particular disease, COVID-19, if you've been dealing with patients who have these long hauling symptoms. Patients
post-COVID symptoms.
Post-COVID, and there was a study that just came out. It was published in Lancet that said in patients who are hospitalized for COVID, regardless of disease severity and regardless of age, 87% have had long hauling symptoms such as shortness of breath, fatigue, myalgia, muscle aches, things like that. It's interesting, doctor, because I think a lot of times after even other infections, whether it be other respiratory infections or things like Lyme disease, there is often a convention in the medical world to say you either have the disease or you are recovered. Those are sort of the two categories. But I think what this pandemic has really illustrated for a lot of people within the clinical medical world is that there is a third category, which is that you may no longer have active virus, but you are not fully recovered either. And while the symptoms may be vague and harder to elicit on a scan or some sort of blood test, I have seen this firsthand, teenagers who have recovered from this, and they weren't that sick in the first place, but now they have what's called the COVID nap, where every day they're taking naps for 4 or 5 hours a day, trying to go to school. I mean, it's significant. And I will say, even in our own world of clinical medicine, if we can't measure it, sometimes we don't pay as much attention to it. And that convention has to change. I mean, because some of these inflammatory markers we may not be measuring adequately, or they may have end organ sort of damage that we can no longer actually image or measure in some way, but they're still there. So, the kids, they don't have secondary gain issues with regard to this, but I think we really need to pay attention to these sort of long hauling, more vague symptoms that people are having.
Yeah, this cytokine storm makes like a huge, unpredictable, detrimental impact on human body. But even beyond that, we're talking about psychological, social issues that people are facing after several months from acute episode of COVID-19. It's just incredible. It's so many problems that they're facing now. So, Dr. Gupta, let's talk about the future. So we heard from Bill Gates, who mentioned that this pandemic probably be over sometimes in 2021. I've heard some other projections. So when do you think this pandemic will be over and we'll go back to normal? Will global pandemics like this become the new standard, or this is anomaly? Should governments start preparing for this as a regular occurrence? So you mentioned about SARS of 17 years ago. Now it's probably third coronavirus epidemic. Now it's a pandemic. So what to expect in the future? So should government governments be prepared more, for this kind of occurrences?
Yes. So two questions in there. First of all, in terms of when this one might be over, it does depend a little bit on how we define over. What is the sense of normalcy again? I mean, on a practical level, we talk about these vaccines as sort of a marker of being able to return to normalcy. But it's going to take a while for these vaccines to be distributed. Some of them may require 2 shots, and it's still not entirely clear how long people will have what are called these neutralizing antibodies. They'll actually have immunity as a result of that vaccine. Will this be a yearly sort of thing that people need? Or will it be one of these things where you do it once and you can bring the viral transmission low enough that we don't need to vaccinate people again? It's an audacious project. I mean, you don't think about big adult vaccination projects like this. We think about vaccinating kids, but polio, which is still ongoing, is probably the closest example. And that's been, decades to try and vaccinate people around the world. I think with regard to whether or not there's going to be other pandemics, I think one thing to remind people think about this as sort of what they call a black swan event, a very, very unusual event. And I understand that, but I don't know that I would necessarily say that that's the case, because we do have a virus that is very contagious and has depending on how you look at the numbers, a fatality ratio probably around 0.5%. That's probably what it is, 0.6% maybe. Far deadlier than the flu, but not the 2 to 3% that people originally thought it was going to be. But if you look at countries like South Korea and Taiwan and places like that, they've had very little impact from this. They're still dealing with it, but the number of deaths, the number of overall infections has been really low. Most countries around the world could have been in that position. Again, there was no vaccine, so it was basic public health measures, testing, tracing, being diligent, mask wearing, things like that made a big difference. What I worry about, doctor, is a true black swan event, which is a event that not only reveals a virus that is very contagious, but has a lethality ratio that's even higher than the one that we're seeing now. If it gets closer to 2 or 3%, I think that could be really devastating. And I think that that's a concern, because there's constantly this process of viruses jumping from animals to humans. There's surveillance that happens, but a lot of the funding for that has been stripped over the years. So I think we really need to invest heavily in that early surveillance, and then make sure that, again, even if it's a fatality ratio of 2 to 3%, if we apply these basic public health measures, we can still tremendously mitigate the impact of this virus. I mean, Doc, right now in the United States, there have been 210,000 people who've died of this virus. I mean, it's hard to even say the number. And I know some of the families who've lost loved ones, and the last thing they want to be told is that their loved one died a preventable death. Nobody likes to be told that. that as a doctor yourself. That's very tough to hear that. They could still be here if we had only done this. But there are lessons to be learned going forward, because we are going to deal with other events like this, and maybe even one that's more of a black swan event. And we have to remember that the basic public health measures can go a long way towards this. In 1918, by this point in the United States, the first 6-7 months, 75,000 people had died. Now, the population of the world was a third of what it is today, but still, how is it that 100 years later, with ICU care, hospital care, all that we've learned about medicine, we are still basically, having a very similar number of absolute deaths in the midst of a pandemic? That's because of basic public health practices not being followed.
Yeah, so Nasib Taleb probably haven't even figured it out. Like, I could not imagine that black swan will be having such a feature as coronavirus or this kind of pandemic. This is true black swan, but we may see even worse than that. Yeah, absolutely agree with that. Somehow related to that, so how Mr. Trump is doing? I understand that he received the antibody cocktail from Regeneron, remdesivir, some supplements and stuff. Do you think this right way to treat? I'm asking you as a doctor to treat coronavirus. So, and what do you think about Regeneron monoclonal antibodies? Is it something that technology should focus more during the next several years?
Yeah, I am. I'm very optimistic about the antibody treatments. We've done a lot of stories about antibodies overall, both in terms of what we call convalescent plasma, which basically you're just taking plasma from people who are survivors of COVID and using that plasma, or these monoclonal antibodies, where they're taking some of these very, very specific neutralizing antibodies that can really neutralize the virus, and they're actually using two of them. That's why they call it the cocktail, and using that in somebody who is early in the course of illness. There's a lot of reasons to be optimistic about it, and as you well know, the monoclonal antibodies have been used for all sorts of different things, including other infectious diseases. As is often the case, we wish we had more data on this sort of thing, because while, as you and I both know, we have to be humble here. It sounds right. If you have an infection and you give people antibodies, which are these proteins that can help neutralize the virus, that's a good idea. It should work, but does it work for everybody? Is there a perfect time to give it? What is the right dose to give it? Are there potential side effects? Are there interactions with other drugs? We don't know the answers to those questions, and that's why you do trials. So for example, with President Trump, he received the monoclonal antibody first, and then he right away, within a day, received remdesivir, which is an antiviral medication. Mm-hmm. It's not really known how those two medications will work together or not work together. He also received, as you well know, steroids, dexamethasone, and he's receiving, right, if he's receiving the standard trial dose, that would be 6 milligrams for 10 days. Now, dexamethasone is usually used for people who are later stage of illness because of the cytokine storm you were talking about. Mm-hmm. But as you know better than anybody, it can also, dampen your immune response. Do you really want to dampen the immune response at an earlier stage of infection? So it's very unclear how he's doing or why he received that particular combination of medications with that timing. But he's the president, and we have seen this throughout history when it comes to VIPs. A lot of times the medical care that they receive is out of the norm. People will oftentimes be very aggressive because they are the president or some VIP, and I understand that, but I don't always think it's a good idea, because I'm sure these doctors at the White House, everybody's calling them saying, you got to do this, you got to do that, and they're trying to basically figure it out. But it's worrisome. He's 74 years old. He dropped his oxygenation. He needed supplemental oxygen. He was essentially medically evacuated to a hospital a week ago today. So it's worrisome, and the statistics are very much on his side that he'll recover, as you well know, greater than 95%. But he has to be careful, and he has to also be careful not to infect other people, because he is still contagious.
So, Dr. Gupta, you're a father of 3 daughters. Do you think they will live in a better world after this pandemic?
That's a good question. I would say this. I'm an optimistic person by nature, and I do think that they will be better because of this pandemic. They will be better people because of this pandemic. I think that what happens in situations like this, doctor, is that, and I did an audio book about this. I spoke to a lot of psychologists and sociologists and tried to understand, how do societies sort of change after major events like this, whether it be an attack, whether it be a pandemic, even going back to 1918 and understanding the influenza pandemic at that point. I think what happens is that when people have a significant event like this in their lives, simplistically speaking, it can either be crushing to them, it really crushes their spirit, or they can come out of it more resilient in a way. Like you think about a muscle that is worked out in the gym, it goes through this stress, but then it comes out stronger. I do think that our overall personalities and how we react to future big events, we could be more resilient as a result of that. It's something that I've really focused on with my own kids a lot. But why do some people become crushed by it and other people become more resilient? It's the same experience. So why is it so different for some people? Some of it obviously has to do with where you're starting. Are you starting from a place where you already had very few resources and this sort of event pushes you over the edge? Unfortunately, that's the case for a significant portion of the world and a significant portion of my fellow citizens here in the United States. So we have to live in a world where people can't be living on the fringe, where any kind of event like this immediately pushes them over the edge. They can no longer access basic services, basic healthcare, things like that. We don't want to live in a world like that. It doesn't make anybody feel good, regardless of whether you're on the person living on the fringe or you're someone who has plenty of resources. That is not the world which most humans want to live in. So we've got to correct that. And I think for my girls, having these conversations with them about how they can be proactive and feeling empowered in a situation like this to do something that's positive. So like this situation, really looking at our essential workers, understanding who's on the fringe, and starting to develop strategies to help people like that, I think can be very empowering and help build that resiliency in them going forward. Will we live in a better world? Will they live in a better world? That's a harder question to answer. I worry about climate change. I worry about our response to this pandemic overall. I do worry about our humanity a bit. I've always lived in a world where I thought human beings would not have survived as a species as long as we have, unless we were evolutionarily, sort of designed to do the right thing. And we're running into a situation right now here in the United States where many models show that if we, wore masks, if we had 95% of the country wear masks, that we could save 100,000 lives by the end of the year, within the next 2.5 months. And we still only have about half the country wearing masks. Why? That makes me question a little bit of our trajectory. If we can't be bothered to put 2 ear loops on to be part of a movement that could save 100,000 lives, what does it mean for the types of decisions we're going to make as societies going forward? I'm optimistic. I do think that some of this is because of leadership and setting examples and framing the messages like you do and I try to do in the right way. But we've got to do better, with regard to the basics. We're never going to get the hard things right unless we get the basics right first.
Right. Yeah. Well, somehow related to this question. So what are some long-term effects of coronavirus that people may not be thinking about? They say that children starting school this year will have lasting impact on their education. And one of your fact versus fiction, one of your last episodes is exactly about that. And how true is that, and in what ways?
Well, I spent a lot of time working on that episode, and one of the things that really came out was that we don't know for sure. We are dealing with something that is relatively unique in terms of the global impact here. So do we look at this as an interruption in our lives, something that will pick back up, or do we look at it as something that's going to have a longer lasting impact? And some of this has to do, I think, with how we approach this as adults and parents and educators and everything. I'd like to think it's more this interruption rather than something that's going to have a long-term impact. And again, I fully realize that it depends on where you started. If you're not somebody who can do remote learning, you don't have access to resources to make that possible, it's going to have a longer impact. You also, on a more positive note, you have to look at, like if you look at 1918 and the flu pandemic in the United States, 2 years later, we started what were called the Roaring '20s in this country, where all of a sudden everything came back very, very powerfully. businesses came back, schools came back, higher education started to really transform itself. So, as you know, doctor, some of our greatest advances, even in medicine, have come about as a result of wars. Nobody wants wars.
Right.
Nobody wants this pandemic. But the pace of medical innovation has been forever changed, I think, from this pandemic. We may have a vaccine in under a year. That's never happened before.
Right.
There's, I don't mean to minimize some of the impact on kids and the education, but the idea that it's going to forever put us behind, I don't think history has shown that. I think that if anything, it has made us tougher and hopefully more prepared and wanting to really get back with some sort of in earnest, like we saw in the 1920s.
Dr. Gupta, my last hypothetical question. So let's imagine that you have opportunity to write one single message on a huge billboard at the Centennial Olympic Park in Atlanta. So how would you address the current pandemic in that message, and why?
I think at this point, what I would put on a billboard like that would be to behave like you have the virus. Behave like you have the virus. I think if you and I mean, there's lots of different messages that one can think of, but the reason I picked that one is because if you think about it, I feel fine. I'm not sick at all, but I might have the virus. I may have even had a negative test, but that doesn't even tell me that I won't have the virus tomorrow or the next day. So if you just behave like you have the virus, I think it does two things. One is that it forces you to just be more thoughtful about your actions and how you interact with people. You're gonna want to wear a mask because you don't want to put the virus out into the environment. But I also, it's interesting when I go into places, for reporting where people are being thoughtful like this and have the mask adherence and they're just, the hygiene and just spending an extra minute thinking about things. There's a sense of being connected to those people. It's like, you care about me. You're wearing the mask because you care about me. And I'm wearing the mask because I care about you. It's a silent form of communication as well. And I think it goes back, doctor, to this resilience thing again, and how we take care of each other. So if you behave like you have the virus, then you're likely to act in a way that not only helps protect people around you, but also shows people that you care.
Absolutely, yeah. So we all live in a small world, despite the fact that you're in Atlanta. I'm in Kazakhstan now, but we very close. We're all connected.
We're all connected.
Dr. Gupta, thank you so much. It's fantastic. It's a great opportunity. I really appreciate your time. It's a great honor to talk to you.
It's my honor. Thank you. And good luck to your family as well. Thank you, doctor.
Thank you so much.